The December 1st, South Africa's once again stand at the forefront of the global health fight as we observe World AIDS Day. The nation, which carries the world's largest burden of HIV, will commemorate the day under the theme, Overcoming Disruption, Transforming the HIV Response. This year's focus is a call to action urging renewed commitment to ending the epidemic as a public health threat. The latest figures underscore both the challenge and progress. An estimated 8 million people currently living with HIV in South Africa. Crucially, the country's massive antiretroviral treatment program continues to be a global success story with approximately 6.2 million people on life-saving treatment as the nation reflects on its journey. This World AIDS Day serves as a powerful reminder of the work that still needs to be done to achieve the goal of zero new infections, zero AIDS-related death, and zero discrimination. For more on this, we're joined by Dr Nonhlanhla Ndlovu, the Deputy Director General for HIV and TB in the Department of Health in South Africa. Dr. Ndlovu, good afternoon. Thank you so much for your time. Really do appreciate it. 8 million people living with HIV in South Africa, only 6.2 million on antiretroviral treatment. That means there's a shortfall of about 1.8 to 2 million South Africans who are not on antiretroviral treatment. How do we close the gap?
Thank you very much, and good afternoon to the listeners at home. I think this is one of the biggest challenges that we face as a country, and we did launch a campaign called 1.1 million campaign, where we were saying, let's go and find all the 1.1 million people that we need to get back into the system. Importantly, those are the ones that are going to take us into achieving our 95 goals of the country. We can only do that if we work together with our communities, with our civil society, with our private sector, with the media as well, because we have a lot of people out there who started treatment, dropped out of our facilities, and that needs to come back, that we've been working since last year, the end of the year last year, until now in ensuring that they come back into care. And we really are urging everyone to come back into care. Our facilities are ready, and we have been on the ground with all our stakeholders trying to find the 1.1 million people. Importantly, though, it's the men as well. We find the men are the ones that are coming. We also have children that are out there that are not on treatment and are supposed to be on treatment. We need everybody, hands on the deck in terms of that.
Let's talk about the delivery system for HIV services in the country. That is of big concern, especially after the reduced funding in the sector following the US pulling out the financial support that they've given to the HIV program in South Africa. Does our delivery system remain intact, and does it reach the corners of the country that it's meant to?
I think we will all understand that when PEPFAR pulled out in February this year, we really had a challenge, but we had to quickly regroup as a country and go back to our facilities and look at our system and try and get it right. We also went to Treasury, National Treasury, and asked for finances to try and close that gap. They did give us 750 million rand, and part of that goes to research and another 500 to the provinces to try and close that gap, particularly in the areas of getting data capturers, getting some nurses and clinicians to get the system going. I need to clarify, there has never been a challenge in terms of the medication. The issue was always the issue of the service delivery in terms of human resource and equipment. So that money is allocated for that, and all the provinces are working to ensure that that money is used and it closes that gap. But I think as a country, we have regrouped. We are not yet where we would want to be, but we are working very hard with everybody, including our stakeholders, to try and make sure that our services get into power. But we've also looked back in our services and started to say, for efficiencies, we need to look at the issue of integration of our systems. And that is also what we are working on.
Let's talk about stigma, because that still is a big hurdle, right? And it is part of what informs the health-seeking behavior of people, particularly around HIV and AIDS. Testing, for instance, is an important part of it. Disclosure is another important part after the fact of testing. Are we winning the battle on that?
That's one thing that has come out quite a challenge. And I think when we look at stigma, it has different elements. You have internal stigma where people living with HIV, even those with TB, you find that they have internal stigma, which causes a lot of challenges in terms of them coming forward. But you also have stigma in terms of our communities, in our facilities. And I think we also will be launching a stigma index. There is a report that we've gone and assessed, and we are looking at the interventions. We did start as a department to work and train our facilities to make sure that our own healthcare workers are ready to receive our people and also deal with the issues of stigma. But within the people living with HIV themselves, they are working in terms of ensuring that the internal stigma is also dealt with. We are also working with civil society in terms of our communities. And again, I think I'm going to urge the same way here. We need everybody to be able to assist and make sure that we don't stigmatize people living with HIV. And we also understand this is a disease that is treatable, and there's no reason why anybody should feel that they are not treated and they should not be treated well. We should be treating our people fairly. So we are working on that.
Yeah. What does the data tell us about where the vulnerabilities are in South Africa, geographically and or otherwise, that still stand in the way of positive health-seeking behavior and, of course, positive disclosures and people taking on HIV antiretroviral treatment and staying on it? What are some of the input factors, whether it be class-related, geographical-related, that remain a hindrance in South Africa?
I think our biggest one is the internal one that I've mentioned, but you also have people in terms of poverty playing a role in terms of education. Information, I'll say, is the major issue because you see it across the board, and it's mainly because of education and information and awareness in terms of the areas. But when you look, you also have issues of key populations being mostly vulnerable in terms of stigma. Our young people are still facing some of the biggest stigma. Men, in particular, is another area from a target group's perspective. And as I say, that stigma is internal, it's also societal in terms of our own society and how we respond to people in relation to HIV and AIDS in the country. So across the board, facilities are also another area that we found that the stigma is coming out as an area where our own health workers are stigmatized. Those areas are a challenge. So geographically, we'll say across the country, there's a lot of work that we need to do, our facilities, but there are key populations as well that we need to be really targeting so that they are not stigmatized.
Yeah. What is the transmission rate among some of the key demographics and populations that you have identified?
You see that the transmission rates goes as high as 60%, 50 to 60% of our key populations, particularly sex workers, which are quite at risk. And then you also have transgender men who are having sex with men, ranging between 30 and 60%. And then you have adolescent and young women who also have quite high, at about 15% in terms of those transmission rates. So the incidence amongst those key populations are the ones that are quite high. And that's why we really looking at services to ensure that they accommodate our key population who have the highest incidence. But overall, the numbers are also very high on adolescent and young women.
Yeah. How high are those numbers?
In terms of, remember, it's mostly it's up to 15%, but because you have the population that is quite huge of adolescent and young women, over 6 million that are there as a group, therefore you also have a high incidence within them. But the transmission highest is amongst the key populations.
Yeah. How do we get that number significantly down? And of course, the rollout of lenacapavir is an important step towards prevention in South Africa, particularly amongst key populations. How do we get the adoption of preventative measures to be taken seriously and aggressively so among key populations?
I think the issue, particularly the issue of aggressive combination prevention, is important. And lenacapavir, we'll start, we have oral PrEP, which is the pre-exposure prophylaxis that currently exists, together with our condoms and the use of condoms, education, information. And on top, therefore, lenacapavir is the new drug, which is the long-acting injectable that will be coming in the country, hopefully in January, February to be rolled out, which you take one injection twice a year. It will come in quite important as one of the choices within the combination prevention. Importantly, I think it's the issue of going back to the basics. Prevention is still the key, and I think for all the groups, including our general population, we still need to continue driving the prevention messages and the use of those prevention methods that I've mentioned.
Yeah. We're going to have to leave it there. Dr. Nonhlanhla Ndlovu, thank you so much for your time. Really do appreciate it. Dr. Nonhlanhla Ndlovu is the Deputy Director General, rather, in the Department of Health for HIV and TB.